One of the most pressing health epidemics of our time is chronic inflammation and toxicity and their profound impact on our health, especially our hormonal health. Toxins are everywhere, ladies, and we can get very overwhelmed very quickly about how to test for it, how to detox from all of these different chemicals that we are being exposed to on a daily basis. And sometimes we just need to get kind of farther upstream, I like to say, to figure out what we can be doing to help our entire system to be getting rid of these chemicals rather than these kind of hardcore protocols that might actually be doing more harm than good. We're not sure. So, with me today, I have asked Dr. Paul Anderson to come and talk to us about this. He is a naturopathic physician, educator, and author with over 3 decades of clinical expertise. He's a recognized leader in integrative medicine and cancer therapies, having spearheaded NIH funded research and authored several groundbreaking books. Together, we're going to be talking about the critical role toxins play in hormone dysfunction and explore alternative therapies like infrared, red light, low dose naltrexone, and mitochondrial support that could possibly revolutionize how we detoxify and heal. So, welcome, Dr. Paul Anderson. I'm really happy to have you here.
Thanks for having me.
So I was reading today. Now I know you're a cancer guy. You've got a new cancer book. I see it in the background here in the video. Uh, when I was doing some research for today's podcast, I came across a stat that said that cancer cases in people under 50 have surged by 79% between 1990 and 2019.
True.
That's really sad.
Hmm.
I had no idea.
Yeah. Yeah. Yeah.
Wow.
Cancer in what you'd consider younger people used to be really an extreme anomaly, with a few exceptions.
Right.
And I mean, and not, as you said, not like over 100 years, just over, whatever that is, 30 or 35 years.
Mhm.
Um, and it is anything but an anomaly now, and especially there's been a increase in the last 5 years. It's sort of like it was building, and then we've had an acceleration as well. So it's really, it's, I mean, no, it's never great if anybody has cancer, but certainly it's always sad to see it in a child or a young adult, or something like that, where that didn't used to be quite so common. Yeah.
No. And do you, like, with all of your expertise in this area, what do you think has driven that to go up so high? Like, and how much do toxins have to do with it, do you think?
Yeah, I think there's certainly a lot of competing ideas. One of the models that you could look at would be in the US, we have the CDC has cancer hotspots. They're geographic areas
Mhm.
where there'll be a lot of cancer in one area, and a lot of times a lot of childhood cancer, young adult cancer. And what those all have in common are some environmental exposure in the geographic area, which makes sense
Oh,
geographically.
yeah.
Now, there's certainly other reasons as well, but you can't ignore the environmental impact that the world we live in, with the air we breathe and what we drink and eat, is not the same as it was even 40 years ago, and it's certainly not the same as it was 100 years ago. And people will often say, well, how could it be that much worse? Well, if you look at the span of time humans have been on the earth, and then you look at the fact that within 100 years we've created tens of thousands of chemicals that were never known to humans before,
Mhm.
and many of those are not very pro health. They're not very good on our genome, et cetera. uh, that may not be the only reason, but it's got to be a huge reason why
Hmm.
why we're seeing these things. The other thing that, and not, yes, we're kind of starting off on a rough side of the
Yeah.
topic, but because one of the areas that, and just so people know, my practice has always been half people with cancer and
Mhm,
half people with chronic illness that are not cancer.
mhm,
So I've always tried to
mhm.
to keep it balanced. But one area that I've done my whole career is pediatric cancer, which is, really,
Oh,
that's very tough. But
very
things
tough.
we're seeing now that used to be extremely rare are babies born with cancer. And that, there's some unfortunate genetics you can be born with, but the epigenetics that affect mom and then, would affect the baby being born, that might trigger some of those pro-cancer factors. I, I think you can't take environmental toxicity out of that equation. So yeah, to put a point on a really, kind of a downer discussion, I think
Yeah.
the cancer in young people is, I think there's got to be at least half, if not more, the input from environment, which is unfortunate.
Yeah. Yeah. I always get the question, oh, why should we replace our hormones? It's natural for us to go into menopause. Perimenopause is natural, but there's nothing natural about our environment these days. And
Yeah.
I think that we're seeing such a impact on the hormonal system like we are right now, mostly from these chemicals that are now in our environment.
Yeah.
Uh, I've been hearing a lot of talk recently about atrazine, which I don't even know if we have that in Canada. I think this is just an American chemical pesticide that's being used.
Um,
I would like to hope so.
I don't know specifically about Canada, but one of the problems with organic pollutants is that if it's here, it's also where you are.
Right, because
You don't
even
you don't
if
even
it's
have
in
to
the
use
air.
it.
Yeah, right.
Um,
Yeah,
yeah,
true.
so another happy bit of news there. But yeah, it certainly would be more
No
dense
escape.
in areas where it's been allowed to be used. Yeah,
Hmm. Yeah.
yeah. Um, and
But
I
that's
think
a scary chemical.
oh yeah, yeah. I mean, and think of there's 1,000 others just like it, just as bad.
Right. Right.
Um, and I think that, to the point of, well, humans have always had perimenopause and menopause, probably, et cetera, and andropause. Yes. Uh, if we were living 150 years ago, it would look very different than it does now. And we're not living 150 years ago. And so, one of the things that I see, especially in the chronically ill patient population,
Yes.
whatever their age or gender is, if we do not correct their hormone imbalances, we can't get a chronically ill person to start to heal and get better. And part of that is
Mhm.
because their systems, the illness itself disorders their hormones, certainly,
Yeah.
as a
Yeah.
compensation mechanism, but then also your ability to have an immune response and to have a healing response, you need to have some amount of hormone balance or you can't do that. So imagine, you're really behind the eight ball, and then you don't have the right set of, hormone balance, et cetera, to help you heal. Well, it's very unnatural to try and heal with really disordered hormones. So yeah, if
Yeah.
we could transport ourselves back 200 years, maybe we'd have a different discussion, but we're living now in a toxic soup where the the toxins come and they affect your hormones in so many ways. Like, there are whole books written about it.
Mhm.
But just one that we see with people is the binding sites for most of the hormones are one of the first places that toxins go and sit. Well, then the hormone either doesn't work or it works oddly, depending on the type of binding site, et cetera. And then your body tries to respond to that because it's like, well, we made these hormones and they don't seem to be doing what they're supposed to. Well, it's the toxin in the middle, you know. And the second way that's probably very profound is, let's say it's not the binding site. Hormones have metabolism, both to be made, but to get rid of them. The enzymes we use to metabolize the hormones are another huge target for some toxins. And so then if, our enzyme system is slowed down, then we have these, bizarre metabolism offshoots of our hormones. which can be pro-cancer, pro-inflammation, or all kinds of stuff we don't need. And if those chemicals or metals or whatever weren't there, that system would work like it was supposed to. We, but we have all this junk in the way. So yeah, we have. I think that we have just a bigger job to try and keep the ship operating like it's supposed to.
Yeah, yeah. And there's a lot of people, a lot of practitioners, naturopaths especially, that would say the opposite, that it's like, why don't treat the hormone? So let's say there's a thyroid problem, not to treat the thyroid, but rather let's find out the root cause and deal with that. Or if there's a hormonal imbalance, that you go upstream and let's fix the
Yeah,
infection or the chronic illness
right.
first, and then the
Sure.
hormones will follow. But I'm like you, where I've always said, yeah, but if that person has a high reverse T3 and has low
Right.
T3, and so they have a
Yeah.
sluggish metabolism, they feel like garbage, they can't
Yeah.
think straight, they don't want to get off the couch, they're depressed. How well are they really going to be able to
Right.
deal with going upstream and figuring
Yeah.
all of that out?
Yeah, and I certainly understand. And part of like what we're talking about with toxins is that's part of the cause. So you certainly, if we can get those lowered, things will work better. Um, but with my students, patients, I try and explain it like if you break your leg, it will heal eventually. But if we set it and we put a cast on it, it'll heal better than it would
Yeah,
have. But that
yeah,
means we have to use, something external to you to help it to heal. And my idea, especially in chronic illness or people that are, any chronic anything, the yes, the hormones might be like putting a cast on or using a set of crutches to help you heal up. And you might be able to not use them later, but why not use them during the process? Because I can guarantee you from my experience, the process of getting rid of the cause works better if the hormone needs are met, you know.
nice.
And
Yes,
that
yeah,
doesn't mean you don't do both things. And it
yeah,
doesn't mean that you forever need all that. But
yeah,
during the process of trying to heal, yeah,
yeah,
why not do everything we can to make the most of it? Yeah.
yeah, I agree. When you say that, toxins have this affinity for the hormone receptors, is this because they're xenoestrogens, like so that all these chemicals look like our own hormones, so they have this affinity for the hormone receptor, or is there something else involved that as to why it would go and sit on our hormone
Right.
receptors first?
Well, there's a few layers to the answer. So one would be if there is a xenohormone, like a xenoestrogen, where it's a chemical that's got some binding site affinity to estrogen or progesterone or something. Sure, that's kind of an easy one. But a lot of the chemicals and especially the metals don't have that. And
Okay.
so the ways that they do it are rather than just saying, oh, I like estrogen receptors and kind of sitting there, is metals will go to, there's usually ionic binding sites on most channels, most ligand receptors for hormones, and they'll go and they'll sit where a mineral would sit. So minerals are metals, and so are heavy metals, and they often will substitute. The problem is that metals, and this is like if you go to, I don't know, the first 6 weeks of any biochemistry course, they'll tell you irreversible binding toxins in enzymes and on receptors and stuff, and metals and chemicals are high on the list there, which is partly why they're so bad. So there's that. But the other thing too is if you were to do an assay and say take blood and then take a tissue sample and then take the cell membrane out and look at that and look at the mitochondria, what you'd find is metal, chemical, and mold toxins will preferentially be stuck on the cell membranes in the mitochondria. And so part of their dysfunction is the cell membrane is also where the binding site is.
Mhm.
If you mess the cell membrane up, you start to ruin the crosstalk with the hormone receptors and other stuff like that. and you can actually junk them up without even sitting on them. So that's another way. The metals tend to go on the outside of them, and chemicals tend to go in the middle where the lipophilic structures are, and neither is good for you. So yeah, so there's lots of ways chemicals and metals can mess your hormones up. Some are direct, many are indirect, none are helpful.
None are helpful. Yeah. No, and then it does, once they get there too, like you were saying, they kind of knock off your good essential minerals. And
Right.
well, like the heavy is the heavy metal is stronger, isn't it? Like it's more
Yeah, yeah. So
powerful.
that's what makes them toxic is they'll sit there and they won't want to move, you know.
Yeah. Yeah.
Whereas potassium or magnesium may go on and off, because that's what they're supposed to do.
Yeah.
Um, there's something we're going back 25, maybe 30 years at the, I don't know, 25 years, let's say. I started to, because I was a lot of my chronically ill people, I was doing a lot of hormone work. And if you think back 25 or 30 years or more, the idea of, bioidentical hormones and all that was really in its infancy. And we knew, much less than we do now.
Mhm.
We could still help people, but the testing was very difficult and the treatment was sort of,
Yeah.
but I started to notice this pattern. And because I had more female patients, I noticed it in them, but eventually I saw it in males with androgens. And that was in women, for example, a lot of times you get estrogen dominance and you're giving natural progesterone and you're doing all this stuff. There would be a subgroup of my female patients who would just take way more progesterone than it seemed like they ought to need. And you would test them and they had normal levels, but they had all these deficiency symptoms.
Mhm.
And at one point, I must have taken a class or read something, and I thought, oh, I bet this is a binding inhibition or something from a toxin. So I took that whole group of people and I started to test them for heavy metals and other stuff. And 100% of what we call hormone resistant people had multiple toxicities. And as we got those toxicities lowered, magically they didn't need as much hormone, you know. So
Oh.
it's sort of like, and that really got my attention all those years ago. Uh, and ever since then, it's sort of like if someone comes with that history of my labs look really good, but I feel horrible. I have these symptoms. You look, there's probably something in between we're not seeing. And most toxicities, they don't show up on most testing, and you can't see them because you're not doing assays of the membranes. So you really have to go looking to see, oh, this part of the cause. This is why this person, is having the trouble they are.
What are you seeing as being the most common of the toxicities when you do testing for chronic ill patients?
Yeah.
Like, is it
Um,
heavy metals? Is it mold? Is it Lyme?
um, it I'll answer that with context. So the
Yeah.
context is our ability to test non-metal toxicity is really only something we can do in the last 10 years, maybe accurately, sort of accurately. None of the tests are perfect. Um, so if we had apples to apples and we had all of that testing over all these years, sort of accurate,
Hmm.
what I would say is it's all of the above.
Hmm.
Metals were the first thing we noticed because it's easier to test them. You can do ICP mass spec and they're a metal. It's easy to find. Chemicals, we used to have to do tissue biopsies not that long ago, 20 years ago. You just do fat biopsies. Otherwise, you couldn't find them. Now we have technology that's a little bit better, it can get us in the neighborhood of chemicals, and the same with mycotoxins, really. So what I would say now is, and again, it sounds like we have this rapid negative evolution. The people 20 to 30 years ago that I saw that were chronically ill would be the very healthiest of my patients now. Okay. So like the amount that mycotoxins, chemical toxins, metals are available and affecting people it's like uh, logarithmically advanced. So I think now I just assume they probably have some of everything. And if they have a bad mold exposure, or they have Lyme complex where they've got Lyme and its friends, infesting them, that's just sort of the nasty cherry on top, because then you have all this other interference on top that's doing it.
Wow. Yeah, I just feel like it's just becoming more and more prevalent. And whenever we have these patients with hormonal dysfunction, that you just, like you were saying, like they just don't seem to get better. You can give them these
Right.
hormones and they still have all these symptoms, and or they have all these mysterious things that they're kind of coming in with. It
Yeah.
almost always leads back to one of, I always say that one of the top three, which is Lyme, mold, or heavy metals.
Yeah.
And it's like if you keep trying all these different supplements and hormones and tech devices, whatever you've been doing, and you're not getting better, then it's time to go and look for one of these three
Yeah.
infections.
Yeah. Yeah.
Yeah.
It's and a lot of times that, eventually that becomes sort of self-evident, hopefully. And the patient sort of understands that, like, if 80% of the people would already be better with what we're doing, or 90%, and you're in the group that's not, then there has to be something else that we need to, you know, uh, I tell my students that you're turning over rocks looking underneath to see what else
Mhm.
is wrong, and
Mhm.
and that's pretty common. Yeah.
Mhm. Yeah. How how is it that our immune system gets involved with this? Because I want to talk about low dose naltrexone, which has this direct impact on the immune system. And I see it helping with so many of these infections. And it's like, well, what's going on with our immune system when we have these infections?
Yeah. Well, I think that one of the things that is easy to overlook is, and this same thing happens with detox and all that. In order to teach things, we separate them into silos. So
Mhm.
hormones go in one pile, and your immune system goes in another pile. And and with toxicity, it's like metals are treated like they're totally different from everybody, and
Yes, yeah.
chemicals and mycotoxins and all this. um, in reality, there's no way to have one thing without it affecting everybody else. But
Yes.
the immune system and the hormonal system, endocrine system, are intimately connected in a couple of ways.
Yeah.
But most patients will tie into this because everyone's had the flu or something at some point in their life, right?
Mhm.
And so if you think of your body's natural response to getting an infection, there's supposed to be an immediate response by your body to raise your temperature and do all this enzymatic stuff to try and kill whatever's there. But then that doesn't last forever. And your temperature goes up and it does its thing, and then it starts to come down. And then there's resolution. In the olden days, you wait for the fever to break or whatever, that sort of resolution. And then you go out the other side, and what we know now in the last 50 years is, if you don't do a good job on the backside of that, you might develop autoimmunity because you're not getting the signals to stop the immune response. Well, if
Mhm.
you take a step back and say, well, who's the conductor of all of this? Well, your immune system runs off of triggers from, say, bacteria or whatever, and those are cytokine, chemokine chemicals, which tell us to make more fever or make less fever, whatever, or release the white blood cells or do other things. But those are two things. One is they are heavily modulated by hormonal output. And people think the immune system and the hormones? Yeah. On the way up, what those chemicals tell you is to release a lot of thyroid so you develop a fever. And people miss that part. But
Oh.
the thyroid then is, basically taking its marching orders from immune chemicals. And then on the back end side of trying to calm down, Other chemicals go to the adrenals and say, let corticoids out so that we calm this inflammatory response down. And so even under a normal, I get the flu or cold or whatever, and I have to develop a fever and get over it. Um, your hormone system, it becomes very involved in that, and we don't realize it. Well,
No.
to take another step back, that means then that all of my hormones are listening to the same chemicals that my immune system's listening to. And so a couple of ways it messes you up. One is, let's say you have a weird infectious process like COVID. Now most people know more about immunity than ever because it's been all
Yeah.
over, social media about COVID. Um, so one of the problems with stuff like COVID or other things is you might get the upswing and then kind of keep going up. And in the early variants, that was a big problem because you might wind up in
Yes.
the hospital. Um, but even with later variants, you might not do that nice little up and down wave. And so that then goes around and it tells your hormone system, oh, you're not working hard enough. So then the adrenals try and pump out more and they get tired after a while, right? Same thing happens with people with Lyme complex or other chronic infectious disease. They're not having an acute infection. There's just the fire's burning all the time. So
Right.
then the thyroid's confused and the adrenals are confused, and then that spills out to the reproductive hormones because they get into the act later. Um, and so even without toxicity, if you have chronic infectious problems, autoimmune problems, a little mixture of both, your hormone system is just trying to do its job. It thinks you have an acute problem forever, and you don't.
Right.
Obviously, you have a
Yeah.
chronic problem, but your hormone system's feedback is not set up for chronic problems. So then eventually something wears out, or your body goes and puts a stop to it, or slows it down. This is when you develop thyroid resistance, like with reverse T3, your body's trying to tell the thyroid, let's take a break here. Or your adrenals, hyperfunction and then they hypofunction. When that's going on, then your reproductive hormones are actually also trying to respond because they're very
Yeah.
sensitive to inflammatory things. So imagine if that's one whole thing, your whole hormone system could be really, just way out of whack from that. Then throw some toxicity on where you're messing with the metabolism of the hormone or the binding or some other thing.
Yeah.
You can see why it would get very complex. Your body just kind of loses its way. It gets really confused in those situations. So it's but really underneath all of it is everybody from these different silos is trying to respond to the same chemical messengers because they're really supposed to work together. But when we have chemical messengers that don't go away when they're supposed to, we get very confusing signals.
Mhm.
So
Mhm.
for my students, I would say it's sort of like, your brain's trying to control it, and then your brain becomes the worst boss you've ever had because it's like yelling at you to do this and then telling you do the opposite thing and it's the poor hormones are just, trying to do their job. So that's why we see people after X amount of time of chronic illness with their hormones just they've all lost their way basically.
Yeah, no kidding. Yeah, and I never really heard it explained that way, like how much the immune system is tied in
Mhm.
so directly with the hormonal system,
Yeah.
which, it makes sense when you look at things from an evolutionary standpoint. We're still just built for survival and to procreate.
Right.
Like
Yeah.
that's it. That's why we're here,
Yeah.
right?
Yeah.
The inside of your body knows no different than
Right.
just we're here to get pregnant and to survive.
Yep. Yeah.
Right? So if there's this message being sent to the system that things aren't well, there's infection, there's a toxin,
Mhm.
and then that hits the cortisol system, which then, like you said, it brings up cortisol and then eventually it makes it come down over a period of time.
Mhm.
And then that's going to affect thyroid, which they have a bidirectional, very strong bidirectional
Mhm.
relationship. So now we've got this reverse T3 going up, which is the storage hormone, which goes up when there's infection. slows the metabolism down because we don't want a high metabolism. And then that obviously has to say to the body, now is not the time to get pregnant.
Right. Yeah.
Right? Which went, so then your body's going to go, oh, right.
Yeah.
And progesterone and cortisol have this relationship where it's
Mhm.
like, okay, well, now we're going to down regulate these sex hormones that help us to get pregnant. But the body's like, no, no, don't get pregnant right now.
Mhm.
And then this will then relate back to the immune system, and the immune system goes back.
Yeah.
So it's just, you can see it when you look at it from like that overarching, like look at the bird's eye view of all of this that's going on. It makes sense
Yeah.
that they would
Yeah.
be
Very
tied in
much.
together.
And yeah, you're completely correct. We still really like we have this internal roadmap, whatever system, but they're very much there for short-term things like survival things, avoiding death and going towards, food and other good things and reproduction, et cetera. And we also have shut-off mechanisms that are really very rudimentary as well. And you see men and women have the same thing in chronic illness. They both become estrogen dependent in at least in the early middle phases. In men, that shuts testosterone off, so they can't reproduce. And in
Yeah.
women, it throws the cycle off, so they can't reproduce. Now, if you think evolutionarily of how that developed, it wasn't because of modern stress. It was because of things like famine and other things like that. Um, but yes, it affects both genders equally and kind of in the same way, but on different levels. Um,
Mhm.
and one of the problems that you if you see enough males with chronic illness, you'll see 18 to 25-year-olds with 90-year-old testosterone levels,
Yeah,
and it's and then often high estrogen, and it's not because of I mean, there's probably other things, but it's because they've been chronically ill and their body's saying you're not in shape to reproduce, so we should do something to you know to slow that down. It's just really common. Yeah. um
it is, and becoming more and more common.
yeah, very
Yeah,
much so.
right? It's kind of scary. So let's talk about low dose naltrexone.
Mhm.
It's one of the most, for me, it's my favorite prescription drug, I think. And let me just tell you quickly, tell the audience my story of how I discovered it, which was I was doing heavy metal chelation and I was doing really low doses. I was doing the Andy Cutler protocol with DMSA and DMPS and following along. And I was just, every time I would chelate and I would take these supplements that would help get rid of these heavy metals, my body would gain weight. And it's always been very sensitive to weight gain. I had hormonal weight loss resistance. That's why I do what I do now. Uh, but every time I would go through these cycles of chelation, I would just start packing on the weight. And I got so fed up and I was going down the rabbit hole and reading all these different things. And I came across somebody that I think it must have been on Facebook in a Facebook group that said, if you're gaining weight from chelation, try low dose naltrexone. And we're going to explain, well, Paul's going to explain what this is, but it worked. I stopped with the weight gain, and then lo and behold, 9 months in, my histamine intolerance got so much better. I used to get rashes from everything. My arthritis got better. I had no more tendonitis. I was like, this is like a miracle thing. And I knew that it was from LDN because I would stop it and these things would start to come back. So now, fast forward 5 years, I have my mom on it. I have both my sisters on it, my dad on it. My husband just started it. I put lots of our patients go on it because it works on so many different things. So please explain low dose naltrexone.
Yeah, it really is quite something. And as you mentioned, it's a drug. um
A
and it's not
prescription drug.
It's not the
Yeah,
only example of a drug that's used differently at high versus low dose, but it's one of the more remarkable ones. Um, and I've been involved with there's a uh, research trust called the LDN Research
I
Trust.
saw that. Yeah.
And I'm one of their science advisory board. I have a lot of unpaid hobbies that I do. That's one of them. And
Which is the it's like the number one resource for information
yeah,
on
it's,
LDN, just
they're
so everybody knows.
no one would know about LDN if it wasn't for them
True.
hanging with it. Yeah. And so there's a growing, larger group of us around the world. But what a couple of things. First off is high dose naltrexone
Hmm.
is it's very closely related structurally to a drug you've heard of called Narcan, which is naloxone, right? And we think of that when people have a heroin overdose or opiate overdose. And that's very true. That's an emergency drug. That's what it's used for. So naltrexone is a cousin molecule that is very similar and at high dose does the same thing. It blocks your opiate receptors. As a matter of fact, and sometimes people argue with me on social media about this because they don't know better, uh, but if your emergency room is out of naloxone, which in modern times would never happen, uh, the backup is supposed to be naltrexone because you can still save someone's life with naltrexone. It's just harder to do.
Ah.
So they're the same thing, really, an opiate blocker. Now, one of the problems that comes with understanding how low dose naltrexone works is, and for the first 10 years of people trying to get the information out, this is what we thought is, well, it's an opiate blocker, so all of its effects must come from the blockade of the kappa and other receptors for opiates that are in the body, which is true. Some of it does come from that. But if that's true, then why would I, at high dose that I might use for a drug overdose, do I get different effects on the immune system than I do at low dose? And so, for example, a common high dose naltrexone might be 50 milligrams to 100 milligrams. A common low dose is about 10%. It's about five, 4.5 to five, maybe lower, maybe a little bit higher. So how could I take something that its job is 10 times higher dose and have it do anything in my body? Well, it turns out that at these low doses, and of course you have to take it for a while, for it to kick in because you're not giving much. Um, at these low doses, it has an immunomodulatory effect, which we can talk about, and it's through opiate receptors and many other receptor areas. It turns out it does much more than that at low dose. It's just because we knew about it from high dose and its job was to block opiate receptors. That's all we thought it did. And
Hmm.
in modern times, that's not true at all. But we didn't know any better. So the way that I try and explain it in what we call modern times for LDN now is it's not really going and blocking things as much as it's modulating things. It's more like I call it the traffic cop effect. And I have this diagram of different immunologic checkpoints that I used to teach about it. And I have these like, little, colored circles on the different checkpoints. And so you look at like the immune system flow, and there's checkpoints to say speed up, slow down. LDN mostly is helping those to modulate into a normal band. So to try and be more, normal or regular. It's not at high dose, it shuts things off.
Okay.
At low dose, it more goes in and says, let's flow through here like we originally were supposed to do, because it's just enough dose to do that. And so it's a very big picture immunomodulator. Now, if we go back to our story earlier of how do, say, metals or chemicals and stuff, but metals mess up hormone binding. Well, also these checkpoints are messed up by metals and other stuff. So you go and you start to detox the metals, and we see this with hormones too, but you start to detox the metals, and suddenly the hormones are binding where they didn't used to bind, and your body's now reconfused. It doesn't know, now I've got hormones I didn't used to have them. It's kind of the same with the immune system flow. It's like, oh boy, we're moving faster than we used to. Should we shut that down or not? So LDN, being sort of this master traffic cop at all the different stops and everything, goes in and says, let's just do this at the right level of modulation. Let's not overreact or underreact. And we'll do this while you're removing whatever is going on. I'm saying this as if naltrexone has its own mind, but that's basically
Yeah,
what it
yeah.
does. Um,
It
and
does
and
feel like it
so
has its own mind. So
yeah, it's like, so if you think about it, and that you're not alone, as like detox induced weight gain, water
Mhm.
gain, it's very common. A lot of that is simply because you're taking a lot of the former suppression from toxins off, and now your immune system again it's doing what it's supposed to, but it's maybe signaling other things, like maybe the hormones that help you hold on to water, or maybe hormones that do other stuff. Uh, because we didn't bring them up before, but all your blood sugar response hormones and your satiety response hormones are also related to all this, disruption that goes on when you're toxic or sick or something. So LDN, again, at lower doses, you're not getting that sort of clamp down on the opiate receptor shut off like high dose would do. You're getting sort of, we'll do a little with these opiate receptors, we'll do a little with other stuff, and we'll kind of modulate the immune cell's ability to put messages out. So it's not that we're shutting the messages off, but it does have the effect of kind of slowing down the messages that are more pro-inflammatory
yeah, I was
and
gonna
kind of the
say
angry
that. Yeah.
messages, and allowing some of the more calming things to happen. Um, so that's how LDN works. And what we also know now is there's not a right, there's not really a low dose naltrexone dose. There's a range. Uh,
Yeah.
it's definitely lower than the big doses, but there's a range in the small end of the pool. And some people respond to tiny doses, like way lower,
Yes. Like
and other people
0.25.
takes more. Especially people who are really sick and they're just starting and all that. Sometimes it actually takes a little bit more, and then they calm down. So that's hopefully an explanation of why it works. And if
Yeah,
you,
because it's kind of confusing, I think. Like
it is, and one of the, and yeah, I guess I'm sensitive to this because I teach about it, and people, you know, even doctors, it's like human nature affects all people, healthcare practitioners especially. And it's like, I just want it to work one way. I don't want it to be complicated. And it's like, sorry, I have bad news for you. Um, and so I'll get questions and they'll say, well, naltrexone blocks this place, and maybe it's a particular inflammatory intermediate or a checkpoint or something. It's like, well, it acts in that one place, but it acts in like 100 other places too. So you can't make up this theory about naltrexone doing this because this one thing that that it does. It has this sort of family effect that it does. Uh, and to be fair to people, like a lot of this is newer information, that because who would have thought to study low dose naltrexone, right? So many
yeah.
years ago, HIV was its first use in the 80s, and then some other chronic stuff, and then cancer. And I think I became aware in the 90s, so fairly early on,
Yeah.
and then have used it a lot. And the research started with just here and there. Now we have research in pain management and cancer and a lot of autoimmunity and other things, which the autoimmune research is mostly how we know all these other things that I'm discussing right now.
Well, what I find so interesting about it is how many different things that it helps. Like as I said before, every family member I've had
Yeah,
on it, some of them
yeah,
are still taking it.
right.
And it's
Yeah,
done something different for each and every one.
yeah, exactly. Yeah,
Right? Like my sister is like, oh my gosh, I sleep so much better. I can't sleep on it. So I have to take mine early in the day.
yeah, yeah,
And then she's like, oh, my varicose vein pain in my legs, it's gone.
yeah,
She suffers with a little bit of depression. So she's like, I really noticed that my mood's better. My mom has like weird chronic nerve pain, and she's like, I'll never ever stop taking LDN
Yeah.
because it's the only thing that's
Yeah.
helped. My father got something with gut, like it helped heal his gut problems.
Yeah. Yeah.
Yeah, right. So it's like it's so different. And I always just thought, okay, well, if it's, I kind of thought it was maybe upregulating the immune system. And so it was like whatever was, so you have a compromised immune system causing inflammation. That's going to look different in every body
Right.
as far as
Yeah.
what is that doing to that person. Some people it may be showing up as a gut problem. Other people like myself, it was weight gain, it was sore joints, it was hives, it was, so that was my immune system issue, or what my immune system was causing, how it was showing up.
Mhm.
So LDN helped
Yeah.
that to get better.
Yeah.
Is that a good way to
Yeah. I think that that's,
the
it's a good way to
layperson's
explain
explanation?
why would it help completely different problems, and it's and it's because it's not really it's bringing balance back to the system that is aggravating those problems. So if you have an immunologic imbalance and you have more likelihood of joint inflammation, your joints are going to hurt. If you have more likelihood of brain inflammation, you might not sleep well, you might have OCD, you might have depression, whatever. It's all the same signaling chemicals. Or if you have, you know, hormone toxin mediated issues, that bothers your immune system. Get your immune system to calm down and work like it's supposed to. Those things will be better. And that's one of the things that is hard to wrap clinicians' mind around about naltrexone, because it's like, well, how could it be used in cancer and autoimmunity and pain?
Yeah,
And it's because it's helping bring sort of normal regulation back. And because those immune pathways affect every system, why not?
because in the immune system, as we were discussing earlier, is intertwined with all of
Mhm.
these things, right?
Yeah,
Cancer,
you can't have
hormones.
a living part of your body that the immune system doesn't have something to do with. Yeah. Yeah.
Yeah. And some people don't get anything from it. I should say that. Like
Yeah.
there's
It,
definitely a small group of people that don't get anything from it.
it's and I always caution folks that especially if we have something that we know is going to take a while to work on. It could be
Yeah.
like mast cell disorders, autoimmunity, cancer, things that it's a deep well. I will often tell people, yeah, you might have something immediately, and you might be real happy, or you might be disturbed because you don't sleep, or we'll move it around. But a lot of people, if it's a base treatment and it's for cancer, or it's for your, whatever your autoimmune condition is, or bad mast cell dysregulation, you just need to take it regardless, because it's eventually you'll feel the difference. But in the beginning, if everything's, sort of like your body's juggling problems, the naltrexone is just going to be in there doing its job. And it's going to take a while to feel that. Um, a lot of folks who notice it right away, they've kind of dealt with a lot of the other things, and they get in the way of you feeling what the naltrexone is doing. So, yeah, it's, I mean, if someone's just taking it because they thought it was a good idea and they don't notice anything, maybe not. But most people like that I use it with, there's a bigger picture we're trying to get to. And hey, if people have a great benefit right away, that's just a bonus. But
Mhm.
it's kind of like optimizing vitamin D and K in your body. You're doing it not to make your labs look better, you're doing it to make your immune system happier. And so you just need to sort of do that. Yeah.
It makes your immune system happier.
Yeah.
I like that. Yeah. And
Yeah.
that's definitely what it's doing. And it does take time. And I've heard from many people that they didn't realize what it was doing until they stopped.
Yeah.
They think, oh, this isn't doing anything. Why am
No,
I taking this? They
it's
stop it. And then all of a sudden they're like, oh, wait a second. And I definitely did that. I thought I took a break from it because I had heard that you should take breaks from it. So I was like, okay, well, I'm going to stop it for a couple months. I thought I injured my wrist. I was like, what did I do to my wrist? I couldn't figure it out.
Mhm.
And then I realized, Oh, this is I used to do body work for like 20 years. And so I had really bad tendonitis in both wrists. And so that it was coming back. And then my food sensitivities that caused my hives
Yeah.
started to creep back in as well.
Yeah, that is the biggest thing, is rebound. Like it's like you forgot how what it was doing.
Yes.
Yeah, yeah, I'm only smiling because I've seen that over and over where it's like I stop, it's expensive, and now I have whatever back. I forgot I had that problem.
It's not,
Yeah,
well, in Canada, it's not expensive. I pay
it's
$30 a month.
it's not bad really, but
Okay.
it's
Yeah.
like it's
In the
an
States,
out-of-pocket
it's
expense that people,
yes.
have. And yeah.
That if they think isn't working, they're like, get rid of it. And then they're
Right.
like,
Yeah.
oh,
Why
wait a
am I
sec.
doing this? Yeah,
Right? Do
exactly.
you use it a lot?
Oh yeah. Yeah.
You do. Yeah.
Yeah. Yeah. All the time.
All the time. Yeah. Me
Yeah.
too. Obviously, me too. But
Yeah.
yeah, I just think it's this little hidden gem that more
Oh,
people,
definitely.
more
Yeah.
more practitioners should be utilizing.
Yeah. I mean, I suppose that's one of our main goals at the Research Trust is to, educate people. Um, and we have different documentaries on different disease processes and to try and both reach out to patients but also practitioners,
Mhm.
so they can see, not only the research but patients who are affected and other stuff like that. Because it's a you would think it's not a large jump because it is a drug to say, well, we're repurposing this drug in a little bit different way. That should be a little easier for the medical system than say, some other thing. And I would say largely the having it adopted, really around the world in medical settings, it is easier than a lot of other things we might do in
Mhm.
natural medicine to get in because it's like, oh, I've heard of the drug, don't know why you dose it that way, but okay, show me some results, and it's not so bad. But yeah, yeah,
Do
it's
you
it's
do you
I wish it was used more.
same? Do you think it's safe to stay on it all the time?
Yeah,
Yeah.
yeah.
Do you make your patients take breaks from it? Because I don't like taking breaks, I have to say.
No,
No,
no.
no.
The only thing we've learned in the last 10 years is in non-cancer purposes, it's probably best done at the lowest dose that works kind of continually, and you really don't need a break. Um, in cancer, the effect on cancer cells is augmented by cycling it, but that's like on a weekly cycle, not like long term.
Okay.
So what I tell people is because people calendars make sense to people for following things. It's like Monday through Friday are your naltrexone days if you have cancer, and the weekend you take off.
Okay.
And so that's how we get folks to cycle. And that's just sort of a unique thing about the immunomodulation and cancer cells. It doesn't work
Okay.
that way so much. Like there's a couple rheumatology specialists who deal with, especially with MS and some MS patients, it's better to cycle, but mostly it's cancer patients where we do that. But taking breaks is not necessary
Not necessary. Okay. Yeah, and it has a
for
great
for
safety
general use. Yeah,
profile.
yeah,
Yeah. Yeah. It's very like as far as prescription drugs go, I mean, it's really like the worst things that you hear about are, oh, it can give people nightmares and make people
right.
kind of feel funny, some people.
Yeah, and it can do that, and
Hmm.
we have people start taking it at nighttime, and if they get sleep disruption, pardon me, hold on, got excited about sleep disruption. Yeah, but if that happens, we just have them take it in the morning. And again, in the olden days, people used to say, "Oh, it has to be done at night or it doesn't work," and that's not true either. So I just tell people, try it at night, bugs your sleep, morning. What's really curious is we have on the trust, as we get together and share things, a psychiatrist was saying the majority of his psychiatric patients, it takes their nightmares away. Like it does the opposite in,
Oh,
and he's like, we almost always dose it at night because they sleep better and they don't have night terrors. And I was like, that's so curious. It's like
that
his
is.
population, of course, is only, psychiatric use, but I can tell you of autoimmune and cancer patients. I don't know what the percentages are, but there's a lot of people we move to the morning like what you do, and
Yeah.
that's
Is they
how,
get the
which is
nightmares
better.
or sleep
Yeah,
disruption. Right,
yeah.
right. And yeah, how is it that it helps mood, like mental health?
Well,
Just
it's
brain
it's really the same
inflammation?
story as the hormones and toxins. Your brain runs on neurotransmitters and stuff, but who tells them to do things are those chemicals that the immune system also uses. And so if you're thinking about, well, who's going to up and down regulate my dopamine or whatever, um, if you have this traffic cop effect of it sort of smoothing the flow of all those, pro and anti-inflammatory chemicals out, your brain is very sensitive to those. Now, a lot of people don't notice it because that's not where their trouble is. You notice in your joints, right, or somewhere else. But it's sort of like in acute and long COVID, and I just use that example because everyone's seen that in the news for 5 years.
Yeah,
Um,
yeah.
why would so many people with long or acute, late acute and long COVID exacerbate their depression or their anxiety or their OCD or their sleep disturbance or whatever? It's because the immune dysregulation is affecting their brain's regulation.
Mm.
And so naltrexone is affecting your brain's chemical regulation through all these, immune chemicals. Everyone takes their marching orders from the same chemistry. They just do different jobs with it. So, and again, if that's not your area where you have issues, you wouldn't notice it. But if
Hmm.
you do, it's like I think you had said maybe sister or somebody in the family there,
My sister. Yeah.
maybe a little depression or something like that.
Yeah.
If your brain tends that way, pro-inflammatory activity will make depression worse. It'll make your ADD worse. It'll make anything worse. Immunomodulation will make it better. Now, it might be a little better, it might be a lot better, whatever. And maybe that's why the psychiatrist will report that a lot of those things that we see as side effects go away in their patients because their brains are more inflamed or something
Hmm.
like that. Yeah.
Yeah. Okay. That makes sense. And then to bring it full circle, then, if somebody is dealing with a toxic load, whether it's
Mhm.
mold or heavy metals, and they're going to embark on some sort of detoxification, low dose naltrexone, because these people tend to be highly inflamed and their immune system we know is being activated, this can just give it this, like, it's a great tool to help calm the immune system and kind of give it what it needs, make it a little bit happier.
Yeah.
Is that fair to say? Yeah.
Yeah, it's a really good base to have. Yeah.
Yes.
Yeah.
Yeah. That's it. I mean, I think it's just been so great in my own journey. So for that purpose. Next up, uh, infrared sauna and red light therapy. I've listened to so many of your videos about this because I find it really fascinating. I just myself got a sunlight and sauna earlier this year. So it's my first like sauna. And so I've been trying to kind of dig into how can this help me? Because it's supposed to be so good to get rid of heavy metals and mold.
Yeah. Yeah. So
How is
this
that even
there's a
possible?
few layers there, but
Yeah.
um so let's start with the detox oriented things. Most saunas that are using light waves are somewhere in the far infrared bands, and there's different levels of far infrared, but they're usually far infrared because that goes the deepest and heats up your tissues, which heats you up, right? Um, so there's a mechanical detox, and we've always, well, I don't know always, but as long as we've had research on this, chemicals and mycotoxins, which are chemical toxins, like to go out when we sweat. Okay, so that's one thing. In the last 15 years, we have accumulating more and more papers showing metals also go out through your sweat. That used to be thought of as a harebrained idea, but it turns out that's true also.
Okay.
So you sweat out most toxins. Metals are least known about, but it's actually true. You do that too. Um, and so there's a mechanical thing of the wavelengths coming and heating up my skeletal muscle for the large part, and then that causes the mitochondria in the skeletal muscle go faster, and then I sweat and all that business. So toxins go out mechanically. The other thing, though, that if we bring down, from far infrared down to infrared and red, we go down the scale. We also have effects in the lower bands like near infrared and red, which will warm you up a little bit, but they're not enough to make you sweat, usually like a
No.
sauna. That's why they use far infrared for saunas. But what red and near infrared do, which far infrared also helps with, is that they go and they absorb. Either red kind of goes through, now on your hand, on thin areas, like your hands or something, it goes quite deep. But let's say it's, over your arm or over your chest or something, you've got, more fat underneath and everything else. So red gets down into the vasculature at the top and down into the fat a little bit, and then all the vessels above. What it does there, though, is the red then has three different mechanisms by which it changes your metabolism and affects your mitochondria. Well, if you again go to near infrared, it goes a level deeper. And so it goes into, the subcutaneous fat and into the muscle. And then you get kind of those same benefits that far infrared was doing at the muscle with helping the mitochondria to work better. It helps the mitochondria to, I'm going to simplify this, but
Mhm.
you could say detoxify, and people would argue with that. But because of its enzyme changes and changes directly on mitochondrial signaling chemistry, especially near infrared gets in, especially your muscle, and starts to change that. And so it helps on all those levels. Far infrared goes much deeper, it'll go into your muscles and maybe deeper. So there's a lot of that. It helps to sort of push you to initially maybe a pro-oxidative clean the trash out section, and then an antioxidative healing sort of, set of signals, which is why the red near infrared, light pads are so useful for all sorts of stuff. People used to think of them just for physical therapy, like joint, pain, or which are very
Mhm.
good for. Um, During COVID, when no one was going anywhere, and we were in the earlier variants, when we had people with lung inflammation, heart, and everything, we started to use red near infrared pads directly over the organs, and we'd have people get them sent to them, and because we couldn't see them or whatever. And then they started to do research to show why that would work, and indeed, there's a hospital research protocol where they took people in the ICU. They made a vest which totally looks like someone made it in their garage. It looks like made out of duct tape. And it had red near infrared. So you put the vest on, it's on front and back. The reason they did that, though, is half the people they didn't turn it on, and the other half people they turned it on. And so they didn't want them to see
Good.
if the vest was working or not, right? And
Yeah.
it's just the vest looks so funny if you look at it. But anyway, the people who got the red near infrared and it was turned on had faster trips out of the hospital. They had less inflammation, all the good stuff, right? And if you can do that with red near infrared, and it's the same wavelengths you get with most red near infrared, nothing special really. Uh, then imagine, that could be helpful on a lot of levels, right? Doesn't just have
Right.
to be COVID. Um, so that's what it's doing and how deep it goes. And there's a, if you had to pick one or the other, so your pad could only come with near infrared or red, probably have you get near infrared because it goes a little deeper. but there's also a thought that having sort of those two levels of goes this deep and this deep might also be helpful because you're stimulating like the circulation with the red and the organs more with the near infrared.
Like they have a
Uh,
synergistic kind of,
yeah,
they
so it's
help
sort of
each
like
other to work
you're giving
better.
a little help to both sides of the equation. And then far infrared, it's really going deep, essentially, muscles and internal organs. That's why you heat up. Yeah.
So can you get too much far infrared and red light?
Yeah. That's a that's an answer that's changing over time. It's a little bit like the
Mm-hmm.
LDN story where it's like we used to
Mm-hmm.
know this and then we decided maybe that's not right.
Mm-hmm.
Um, so it used to be commonly stated that like red light therapy and infrared therapy would trigger cancers and other stuff
Oh,
like that,
I
right?
haven't heard that.
Uh, oh yeah, this you live long enough, you'll
Okay.
hear from people, yeah. Uh, and you definitely had to not do it with cancer. Well, then in like 2012, 13, they started publishing papers saying there's got to be more to this because in non-cancer tissue we'd be worried about that, but it seems beneficial in cancer. So there's a missing piece in our knowledge, right? Now we use different colors, but red, near infrared with cancers and with non-cancers and other stuff. And then the timing thing is it's a little tricky because studies will be set up with really high powered devices, either lasers or high powered LEDs that you could never buy for home use. So they'll use them. And what their goal is to see how short of a treatment can I get to affect this organ, whether it's a joint or whatever. But if you read the study, it's like, well, they're using this hospital device that's got, you know, a lot of power. So maybe you only need a minute or 5 minutes or whatever it is.
Mm-hmm.
With most lower powered home devices, or even most of the lower powered professional devices, you probably are getting those benefits. If it's 1 to 5 minutes with a super high powered or laser device, you're probably needing 10 to 30 minutes, to get those benefits, right? So it's relative to, you know, wavelength is a factor, but the power is a factor and then time is a factor. And so if I go down on power, the time has to go up with the same wavelength. This idea there. And people miss that. It's like, well, the study said I only need, a minute for my eye problem or whatever. It's like, well, yeah, but you don't have that many watts you're generating in your home device or
Yeah.
whatever. So that's a big part of it. So, like anything, there's probably a time at which you just it's a diminishing return. And they do talk
Mm-hmm.
about different light wavelengths, sort of a biphasic effect. So I think you have to be thoughtful about that. But most most home devices, I think the margin's pretty wide, you know.
Okay.
Um, Also, though, because it does affect the mitochondria,
Mm-hmm.
a lot like the naltrexone discussion, some people will just go to sleep, like they're doing near infrared red light therapy. It knocks them out. Other people can't sleep. Like we tell them, don't try it the first time in the evening because if you don't sleep, you won't sleep. And it's all because, well, what is it doing to your mitochondria? And then what are your mitochondria doing after that? Well, that's. In everybody.
Yeah.
So a lot of timing comes in as far as, okay, if you're a person who, as soon as the red light hits, you're, unconscious, you probably have things that your body's working on, and that's great. If you get revved up, do your red light in the morning, and it'd be, and those people, the people that get really hyped up, it time is more of a comfort thing with them. It's like you could probably do 2 hours, but 30 minutes is probably going to be your max, or you're going to be
Too high
too out
wired.
there. Yeah. Yeah. So it's kind of the same story though. We all have different things that our cells need to do or that they're working on. And so that gives us why we get the effect we do from it. But the
Mm-hmm.
net effect is very healing and detoxifying. Yeah.
Yeah, and for heavy metals, because heavy metals and mold and all of these things, they do affect our mitochondria.
Oh
And
yeah.
so is the infrared and red light, is it working on different, like multiple different things when it comes to mitochondria? Like it's helping us remove the toxins by sweating it out, but then is it also just helping the mitochondria to work better?
Yeah. Yeah,
Okay.
so it's doing all the above. Yeah, it's
Okay.
doing all the above. Um, in the mitochondria, which so we talked about the cell membranes where the hormones bind, and most of their, you know, signals to the cell are from those binding sites out there. Then on the inside, you have the mitochondria and the nucleus, and certain hormones bind in there. Thyroid and cortisol directly affect those guys. But toxins, just like they bind on the outside of the cell, metal toxins, the reason your mitochondria makes energy is it's sending electrons through a system that's a lot like an electrical wire with current, only you're a, a mammal, so it's not a wire. It's a wire made out of human stuff. Well, most of those things have some ionic intermediates, and so metals go in there and they just stick. So cadmium is a huge mitochondrial poison.
Oh, I
Most
got
other
lots of
metals are not great for
cadmium.
your mitochondria. Getting it out is super hard. So if we do anything to help the mitochondria work better,
Right.
two things happen. One is the mitochondria itself can dislodge some of the junk, but also if the mitochondria start to speed up, they will there's things that go in the mitochondria to help you make energy, but also when you make more energy, your cells start to take more trash out. So getting the
Um,
mitochondria working, in addition to just the sweating mechanical thing, also turns on the cell debris removal system. And there's lots of different mechanisms for that. But, and again, it kind of goes back to if your body is really turned down because you're toxic or chronically ill or all the above, um, the trash is not taken out as regularly as it's supposed to from your cells. And part of that's the mitochondria have been told to slow down. So if we use light or we use other, nutritional or mechanical things, we get more junk taken out because the mitochondria are working faster, and maybe working like they're supposed to. But getting the garbage out is a huge thing. So detoxing is sort of on lots of levels. But if
yeah.
you're the longer you've been sick, the more junk you've built up in and around yourself because you just can't move it out.
Is that what happens when people that have these chronic illness or toxins and stuff, if it's been a really long time, you'll see people get overly reactive to everything. Like they'll get chemical
Yep.
sensitivities, they get sensitive to supplements, they can't take anything because their whole body has this overreaction to it.
Yeah. Yeah, it's and normally it's all of these kind of bad guys we talked about working together. Some people have more of one than the other. Usually though, they're sort of in a little cycle. What we I think because people are aware, we hear more about it nowadays. You get people where their mast cell dysfunction gets worse and worse and worse, and they're
Hmm.
reacting to everything.
Hmm.
Or you get people where their hormonal deregulation just gets worse and worse and worse, and you try things and it makes the situation worse or whatever.
Hmm.
Or you get people where some other problem. It's just like everything you do seems to make it worse, and it's just because the bucket is so full, and there's a phenomenon that happens. You often notice it with people who need thyroid and you give it to them and then they get sicker on or their mast cell stuff gets whatever. It's not because the thyroid was bad, but the thyroid went into a system that needed help but was not ready for the help. And so, it's like a bad motor and pushing your foot down on the pedal and making a bad motor go faster. The thyroid does that. Now I'm trying to get rid of junk got no way to do that, so I just feel toxic, or I feel whatever. Same with lots of stuff. You get the responding to everything negatively. It's just because the cells need the help, but there's too much junk. So then it's very difficult. It's a
Very,
clinical
yeah.
balancing act of, can we put things in to chill out the system? Like LDN's good for that, right? Can we do little baby steps? And this is where time and different red light bands I have seen make a huge difference. I've had people like this where their far infrared sauna, we had to start with 1 to 2 minutes, and
Oh, wow.
that got them detoxing just enough. But if they went to 5 minutes, they were sick for 4 days, and 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 a marker of them getting better was we could go from 2 to 3 to 4 to 5 to 10. And it's like, now it's not that they're maybe a ton less toxic, but their body has a way out, right? So you have this, can I give something to help the system like LDN? Can I gently nudge the system with some goodies, whether it's red light therapies or nutrients to support things or detox,
Yeah.
whatever. And then can I at the same time support elimination enough so I don't retoxify the person? And that's, it's a juggling act, but if you do that, then after they get to a certain point, they get less reactive. That's your goal, right?
Yeah.
Now,
Yeah.
I would say some of the people with the most remarkable reactivity that had years of toxicity and other stuff, that trip was 2, 3, 4 years in some people. Some people it's months, right? I don't want to make everyone depressed, but
Yeah.
the kind of patients I
It's
get,
okay. Yeah.
it was glacially slow. And then all of a sudden it's like, oh, I'm not bothered by that anymore. I can do 10, 20 minutes in the sauna. I'm not dead. And it's like, all right, well, we're finally getting things, and then you speed up what you're doing, and it works. But yeah, you kind of have to think about the poor little cells, and especially the mitochondria are in the middle.
Hmm.
And if I'm not doing things to help whatever the removal side is, and I'm just pushing mitochondrial support in and detox support, and then I got no good way out. You can imagine, it's not going to balance out very well. And
Yeah.
then, mast cells are a good example. In To be technically correct, it's mast cells are a group of four main cells, but um, sensitivity in histamine, inflammatory mediators, if you do things and those get worse, it means that there's something not being dealt with on the removal side. That could be infectious things, really common with mast cells. But toxins are another huge thing. And hormone imbalance also will aggravate mast cell problems a lot. So
Mm.
yeah, it's always like, okay, if you blew someone out of the water, or they come to you and say, I got to be really careful because I did this thing. I was supposed to need thyroid or whatever, and I got really sick. It's not that you didn't probably need that, it's that the outlet is plugged up from one of these things. So yeah.
Yeah. And that's nice for some people to hear, I think, is this explanation, because we do have in our clinic, we have some patients like that where and my heart goes out to them. I feel like I'm on that spectrum where I am very sensitive to things,
Yeah.
and we have some patients that they're just like, if they're so sensitive and everything is like, you just got to do it in drops basically because
Mhm.
their body
Yeah.
reacts.
Yeah.
It's like, and they're in such a
Yeah.
state.
And I think to your point, it is good for people to know. Thank heaven, not everyone's like that, but
Hmm.
it's good to know that you have other people in the world who are just like you. And it's not that it's an impossible job. It's just your job has to go in these really tiny steps to
Hmm.
through. And eventually things start to break through and people do, kind of turn the corner. But uh and there's genomic reasons and detox reasons why, you could have siblings, and one is the one that has all the problems, and they supposedly have the same genetics, but they inherited maybe all the bum detox genetics, and the siblings got the other parents genetic, or something. So that happens too, where you just genetically, you didn't win part of that lottery, and it happens to be wherever you're sick, and so then you're more sensitive, and that comes into it too.
Yeah, yeah. I like that the LDN for this. I like the red light and the sauna for people like this, like myself, where we just have to take it slow, and
Yeah,
this can start you slow, and it's going to take longer than if you threw a whole bunch of supplements at
right.
yourself.
Yeah, yeah,
But, and I know
yeah.
you talk a lot about like glutathione and methylene blue, and
Mhm.
these are things that you like to put in the mix as well, aren't they?
Yeah, I think that, like in the case of supporting glutathione, um, on one hand, our body does make its own glutathione, and we have it uses vitamin C and vitamin E to keep the
Mhm.
glutathione regulated. So we have this system kind of built in. So people will often say, well, if it's already there, why am I supporting it? And part of it is that system is there based on prior to 200-year ago history of toxicity and stressors and other things. It's there to keep at a very base level. If you consider all the stressors from toxins and everything else that we have, that system is 2 parts water soluble, 1 part fat soluble. So you can burn it out very quickly if you have a lot of toxic exposure. So again, if you give glutathione to somebody and they don't have a way out, glutathione triggers the removal of things through phase 2 detox. And if
Mhm.
phase 2 and 3 are slow, the removal parts, you don't want to go too fast with glutathione support either, because it's got to like have a place to take things out. But yeah, it's sort of like it's part of us. It's part of something that ought to be going. We are stressing it with modern environmental exposure. So it's kind of a universal thing to think about. And maybe you use little baby, versions, maybe use a lot. Um, and then you get to like methylene blue, kind of like naltrexone, not part of our body, but can be
No.
very helpful. Methylene blue is considered to be the oldest synthetic drug in the world. It's over
Mhm.
300 years old.
It's
It's a
crazy.
dye, hence its
Mhm.
name. Um,
I
but
could
in
still probably see
medicine,
it on my teeth from
yeah,
yesterday, actually.
yes, you have to be careful if you're taking it orally.
Okay.
Your tongue,
My
teeth,
tongue is blue.
and your toilet bowl will all be experiencing some dye. Yeah, it will brush off though. Um, so, why would we use it? Well, in emergency medicine, it really only has like one. It has one job in emergency medicine, which is for a dysfunction called methemoglobinemia, and it's when you have two methemoglobin is only one valent state different than regular hemoglobin, but it's sort of like evil hemoglobin. It goes in and it takes up your oxygen, but it won't let go of it. Whereas hemoglobin, goes in, O2 goes in and out. So in methemoglobin, you have normal blood counts and everything, but you have no oxygen. Well, not no, but you have very low oxygen. So you get pain and all manner of things. Methylene blue is used to reverse that through a number of steps. What people don't often think about, because it's such a specialty drug in medicine, it, in emergency medicine, it's well known for that purpose. It's like a antidote. It's used in neurosurgery a lot, and it's used in neuro. So they use it in other surgeries as an internal dye to see if people are leaking and stuff. So that's one thing. But in neurosurgery, it's used to help after you cut into somebody's brain not have it swell up too much, right? And so you think about, well, how would it help me there? Because that's very different from my blood cells.
Yeah.
And it's because much like red light and near infrared, it goes into the mitochondria kind of through the side and turns on the oxphos mechanism that makes energy, but it doesn't do it like your natural system where you use nicotinamide to turn that on. It kind of literally comes into the middle and says, let's just move faster here. Okay. So it immediately raises the mitochondrial activity. And it's interestingly, the same entry point that red near infrared has. Okay.
Oh.
Also, methylene blue and red near infrared, if you like, have a synergistic activity mechanistically, but also the light activates the methylene blue. So methylene blue is really useful. And if you think, okay, the mitochondria work everywhere, and let's take out our previous problem we talked about. Let's say we're sort of balanced and we don't have a bunch of toxins that can't get out. So we fix that or we're working on that. But we have somebody who's had chronic fatigue or long COVID, or they're recovering after they're done with chemotherapy or what, some big insult. We got everything's kind of good. They're on naltrexone, their hormones are being worked on, their detox pathways are being supported, but they can't stay awake all day. They can't keep their system going. Methylene blue, and even better, red and infrared methylene blue together, start with baby doses and work up. It goes and it wakes the mitochondria back up that now can start to do business, like normal. And what what sometimes people don't think about is the energy you feel. We think, well, it comes from our brain, which is true, but the energy that we feel actually is the sum total of all of our mitochondrial speed and activity.
Mm-hmm.
Well, there's a lot of mitochondria from your neck down. Your skeletal muscle is a big mass, your organs are a big mass. And if they're all in first gear, like with any fatiguing state, then yes, if we speed them up too much, sure, we're going to have detox problems. Let's say we fix that. Now we just need to get you to wake up and have some energy. That's what kind of turning the mitochondria on. So yes, it's not part of your original equipment. We weren't,
No,
set up with methylene blue.
no,
We were set
it's
up with
very strange.
light waves. We were set up for red light and infrared.
Okay, yeah.
So that part's natural, right?
So the red
But
light, it's like it wakes it up or just
right, it
enhances its effects, basically.
literally red light on its own turns the middle mechanisms of the mitochondrion, and methylene blue on its own do it. So together they do it together, right?
Okay.
Um, but if you've had this uh, long term in every instance except post chemotherapy, which is like a long term disease shortened up, your body resets because you've been sick for a long time or you had chemo. And your body now thinks, all I can do is run my mitochondria in first gear. Can't ever get out of first gear. So
Mm-hmm.
your body literally regulates your mitochondria to low percentage of normal because you're sick, and it doesn't know you're not sick anymore. It doesn't know you're working on it because that's not in the original programming. So if we've worked on all the other things, red near infrared at longer spans and methylene blue are a way to go in and say, okay, mitochondria, we've been in first gear for years or through chemo. Let's get back to second and then third and then fourth gear like we're supposed to be. And it just wakes the system up. And then you can actually not need it, later on, because it's more of a let's get the system started. In some people, because some people use it specifically for neurological
Yeah.
things. So they'll use it for depression or ADHD or anything. Well, if your brain has lots of mitochondria, that's why they're using it for that. Probably the bulk of research, it's not to do with uh, emergency problems, is neurological research because
Oh.
it's known in neurosurgery, so that would make sense. But it just basically turns stuff on. So if I'm using it with someone and they have, very resistant depression or they have very resistant ADD, ADHD, something like that, and it's working, I might say, you might need this fairly long term. If it's a
Mm.
chronic fatigue person, long COVID person, we've done all this background work, I'll say you might need it till you're back online, and then you may not need that anymore because a different story.
because it's also antiviral, antibacterial. I mean, it wears a lot
Yeah.
of hats. It's the strangest chemical I find. I love it. I do take it. I don't take it every day, but I like if I'm going to do a bunch of podcasts in a day or I need my brain to be on fire, I take my methylene blue and
Yep.
it really helps
Yeah.
my cognition. Yeah, gives me energy when I travel. Oh my gosh, I love it when I travel.
Uh,
Yeah.
yeah, it's really quite something.
It really is. So it's such a strange thing. Well, thank you so much, Dr. Anderson. I know I've taken up so much of your time, so I really appreciate it. I could sit here and just pick your brain all day. Now, if you guys want more, which I'm sure you do, please check out his YouTube. As you can hear today, he's a great speaker. He's a great educator. He's got so much information on his YouTube channel and in nice bite-sized videos, like time
It's
wise,
way
like they're
shorter
like
than that.
8 minutes, 10 minutes. Yeah, yeah, exactly. Like I'm like, I can't believe he's giving me this much of his time here. You're the 10-minute guy. It's like here you go. Here's your information about this in 10 minutes. And I love that. Even your podcast, there's 300 and something episodes and they're all 15 minutes
Yeah.
a piece. So that's wonderful. Thank you very much for coming on the show. And I appreciate all the information that you've shared here with us today.
Thank you for having me.